You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. I have a very special episode for you all today. I'm sitting down with Dr. Joseph Kvedar, a man who I am very fond of and have a lot of admiration for. Most of you know Dr. Kvedar, but if you don't, here's a quick overview. He's a practicing dermatologist, a senior advisor at Harvard Medical School, and an advisor to many healthcare startups. He's an editor for the Journal of Digital Medicine, and he's authored 2 books, The Internet of Healthy Things and The New Mobile Age, How Technology Will Extend the Health Span and Optimize the Lifespan. It's a true honor to have him on the show again. So without further ado, here's my interview with Dr. Kvedar. Welcome to the show.
Hey, thank you, Roxy. I'm so delighted to be with you today.
Yeah. So much has changed in healthcare and connected health and digital health since we first met probably about 7 years ago.
Yeah. It's remarkable.
It really is incredible. And I think the last time we spoke, we were talking about, we were probably hypothesizing on how the pandemic would affect digital health. And so maybe just kind of start off by sharing with our audience, what's new, what's from your perspective, what's new and what are some of the big trends happening in healthcare innovation these days?
Well, new is relative, but let's maybe choose our anchor point is right around early 2020, just because I know one thing I'll talk about is telehealth, and that's not new anymore, and that's good. I'm glad to hear that, because what I usually start off saying is I can mention to any patient in my office practice now, would you like to have your follow-up by telehealth? And they know what I'm talking about. And that's amazing. And it just, I don't take that for granted at all. So the word's out there. We know what it means. It's part of the lexicon. Almost everyone's experienced it. That's by no means a victory. It creates a floor. It's not a ceiling. And frankly, It's not that innovative, because all we've done is taken what you and I might do in the office and moved it to a video. If Amazon did that, think about how unsuccessful they would have been. So, so we have a long way to go, but we have a conversation now. And I think the reason that there's been so much updraft in the space is because people of all walks of life now sense that innovation is possible, right? They can see the vision of, we could do this virtually, and having all those virtual visits beget the enthusiasm, for instance, for virtual first primary care, which is a huge thing now, and threatening, the businesses of major health systems all over the country. And again, in a good way, because we have to up our game. And so that's another innovation that's really exciting to watch. Lots going on in the remote patient monitoring space, because there's new reimbursement codes. And not just for sort of the old-fashioned devices like weight scales and blood pressure cuffs, although they're certainly growing, but some software as a service tools for things like musculoskeletal and respiratory now being reimbursed through that process. So those are a few highlights. Home testing going bonkers. Again, because when you take advantage of having a virtual interaction with your doctor, wouldn't it be nice to go to the lab? Well, that's coming your way. Home devices, so that you can do more, collect more data for that doctor, so that she doesn't have to say, well, Roxy, you got a sore throat, but we need to bring you in because I can't see the back of your throat.
Right.
Or we really need to listen to your lungs, right? We have tools now that kind of thing can be done on the spot. So lots going on. Those are some of the highlights.
So is that, from your perspective, is that a lot of talk? Is it a lot of new entrants into the market? Are we starting to have some type of penetration, market penetration over the last year and a half or 2 years? Or are we really just scratching the surface in some of those areas?
Well, I think in digital medicine, there's always a lot of hype. That's one of the challenges that we face, is that for some reason, people feel compelled to overstate their outcomes. So that's just always there. And it's one of my grain of salt, commentaries for folks. But with caveat, there is a lot happening. And it's both partly because, as I said, this environment of whether you call it omni-channel healthcare delivery or hybrid, or these days, telemedicine is now about 4 to 5% of healthcare claims. Whereas in the early part of 2019, it was 0.19% of healthcare claims. So more than almost 100-fold more, and that may or may not be the right amount, but it's there in that. And so people just have now this sense that they don't have to travel somewhere to get something done. And with that, there's more money coming from, this coincides with I think, historic time for having a lot of cash out there looking for investments. So if you're a founding CEO, I think you tell me, because you're involved maybe a lot more than I am in this, but it seems like it's easier than ever to get founding capital, and fair amount of it. And
Depends on who you're talking to. There's always that group that's still struggling. But maybe there's a reason why they're struggling. Maybe there's still some work to be done on their business model.
Maybe, But then I see, so I think the venture capital industry is pouring a lot in. There's a lot of M&A going on, as you know. So yes, there's a lot. And I'll just come back to, not to beat a dead horse, but virtual first primary care. Amazon, CVS, Best Buy, United Health Group, Optum, they're all launching these products. For most of them, the premium cost for the end user is less. And the service is more like being Amazon than a corner bookstore. So what's not to like about that, right? So,
Really, really starting to see some transformation in healthcare. As opposed to, so I think that there's probably still a lot of hype, and probably always will be to a certain degree. But I think one of the biggest things that we talked about as one of the big pain points, and probably still is to a certain degree, was just adoption. And I don't think we struggle with adoption to the same degree that we did 2 years ago.
No.
So
I've mentioned a couple of times now, patients are, I forget when I was a kid, there was I forget what, Lay's potato chips, maybe try them, you'll like them, something. But people have had an experience with this now.
Yeah.
And I do my telehealth clinic on Tuesday afternoons. And at least one per week, someone says to me, "You mean that's it? I don't have to, that's all I have to do?" And they're thrilled that we've accomplished whatever it is that they needed without them leaving their home. Like, it's like, oh, and it just sinks in. So people, once they've had that, they want more of it. And so that's going to lead to transformational change on the patient side. On the doctor side, we still have a bell-shaped curve. Yeah. And there still are people who are, I often mention, there were not so many, but a bunch of doctors retired when they didn't want to use electronic records. They just said, "I'm done." Yep. So people that are aging out will look at this and say, "I'm done." That's fine. But for the most part, most of the physicians had more telehealth experience. They figured out things that they could do that were relevant to their practice. As long as there's an income stream, they'll continue to do it. So yeah, there's a lot. And as I said, there's all these adjacencies, whether it's the home testing adjacency, the home devices, other things, different kinds of software that enable the processes. Those people are all going to make money alongside the transformation.
So as a physician or as a health system that's just being bombarded by all of these innovations, all these widgets, 1,000 things that are going to save you time and improve outcomes and improve the patient experience. How in the world do you keep up with all of it?
Well, I thought you were going to ask a different question about how we make choices, but keeping up with it is impossible. And you just, I'm one of the hats I wear is I'm an editor at Nature Digital Medicine, editor-in-chief. So I get to see, it's not quite the same because that's all really early stage research, but it does at least give me a window into what is going on in the very early stage innovation. Mm-hmm. In terms of the startup world, I just do as much as I can. I'm on some boards and advising and read a few newsletters and talk to people like you. I mean, it's a constant goal of trying to keep up. There's no easy way around it.
So I've been in the industry for a while, haven't been in the industry as long as you. But, I've had hundreds of conversations with so many incredible people on the show, and I still haven't found this one thing that I'm looking for. So I'm a caregiver for my soon to be 93-year-old grandmother. And, you've rattled off all of the innovations of, wearables and, digital medicine and telehealth and, virtual care at home, remote patient monitoring. And I'm looking for the digital health Amazon, where I have to sort through Amazon to find it, where I can just go in and go, okay, this is what's going on with my grandmother. What tools can I purchase and bring home to optimize her care? And I'm really frustrated because I feel like if anyone should know that, it would be me because I'm so immersed in the industry, but I still don't even know where to begin because I don't know what all are the wearables that we have to choose from, and all of the different devices, which kind of goes back to where you thought I was going to ask you the question is choices. Where's the store, whether it's a digital store or a physical store, for me to be able to be exposed to all the choices and figure out what I need, especially as a caregiver?
Yeah, that's a really thoughtful question. We tend to view the answer to that question through the lens of either a health system executive or a health provider, but sadly, not enough through the patient or the caregiver. So that's a real need that you're defining. I mean, there are, for instance, there's a firm in the UK called Orca, ORCHA, that does app libraries. Mm-hmm. There are a couple of examples out there of people that are trying to curate. But you're right, it should be just as easy as going to Amazon.com and searching. I agree with you. It doesn't exist. Maybe the reason it doesn't exist is there are many people in your shoes, but there aren't many who would put their own money in there, waiting for insurance to pay for things. And
could be.
That tends to hold up, I think, some business models.
I'd heard at one point years ago that Best Buy was considering, throwing out all their geek squads and making these health kiosks, if you will. Yeah. And I was really excited about that, but I think that they changed their strategy.
That's a company that always is in the headlines with the next thing they're going to do, and then often it doesn't get done. So.
Right. So I've got an interesting question, or at least I think it's an interesting question. So Blockbuster and Kodak are just these classic examples of these behemoth companies where the writing was on the wall, all the big trends were there, and they just completely ignored it, right? And it was their demise. And who, maybe you don't have to name any brands, but who are the brands or the companies that are at greatest risk of being the next Blockbuster and Kodak, because they're still ignoring what's happening and kind of holding tight to their traditional or old business model and not moving fast enough to leverage the trends that are happening today?
Well, I think it's the hospital systems for sure. And I appreciate their dilemma. I mention them because I'm part of one, so I have an inside view, and I appreciate the dilemma. So it starts with the uncertain reimbursement future for just telemedicine, but digital health at large. if I'm a hospital executive, and remember, we go on, we're like on 3% margins, and we're mostly
Right.
nonprofit. So
Yep.
dollars are precious. So if I ask a CFO if you'd rather buy a MRI magnet or invest in telehealth, they look at that and they say, well, the MRI magnet, people are going to need MRIs. I can amortize it. It's easy. The telehealth, well, we don't know when the public health emergency is going to end, whether the private payer is going to do the doctors like it? And it's too much thinking. Let's buy the magnet. So there's that. And then there, on the other hand, as we mentioned now a couple of times, there are all these innovative companies that are coming in to basically eat our lunch.
Yeah.
So the fear that I have is that the hospital will end up being a place where you can get an emergency room, an operating room, or an ICU bed, which is a really small footprint. And then the rest of the stuff will be decentralized in a network, and you'll get it through an Amazon or through a One Medical or Firefly, or pick your favorite example. And they'll contract with like Mass General, where I work, for those things, for the ICU, the emergency room, et cetera. That's a pretty weird view of the future of healthcare, but I think it's a possibility.
I do too. Probably more than any of us realize or want to admit.
Happening pretty fast. So
yeah. So who do you think are the biggest disruptors and maybe it's equal, but should we be more concerned about the Apples, Facebook, Amazons, or more of the 100,000 mom and pop startups that are out there right now?
Well, concern is an interesting turn of phrase. I think of the ones you mentioned, and all of them, I think Amazon has the biggest chance of being successful in healthcare because they're relentless focus on the customer. And in my own experience as a doctor, whether it's in the office or online, I find that when I take care of people, and I mean that exactly what I said, that they like that. People want to be cared for, and Amazon will do that. So I can't say whether Facebook will be successful in the space or others, but apart from that, I think the startups and I would there's certain categories that I think are more likely to be disruptive than others, and a lot of it has to do with the real, and this is going to take a few years, but the real mix between having software interact with you and having a human being, and when to make that transition. So if I often will remind people that I'm not particularly good futurist, but I interact with other services beyond healthcare, and they're 10 years ahead of us. So it's easy to make some predictions, right? And so if you now need something on a website, customer service of some sort, you will almost always interact with a bot first.
Yep.
The ones that do a good job can sense if you really need a human being, and they'll get you to one. The ones that don't do a good job, you feel trapped in this nonsense with a bot.
Nine. Can I speak to a human, please?
We've all had the experience, and I won't name names, but certain companies are known for this.
Yeah.
If we don't do that right in healthcare, we'll fail. But we have the opportunity for, it's not just virtual first, but it's really software first. So when you need when you need something that has to do with your health, Roxy, I don't think, maybe you do because you're pretty far ahead of the curve, but most of us don't immediately go to our mobile device as a first choice.
Right.
But everything else you do.
Yeah.
Right. You're more likely to call my office, leave a voicemail, someone calls you back. I mean, how 20th century is that, right? So we've got to make that leap that you're comfortable picking up your phone and saying, I need X from my healthcare provider, and start working within that. And then again, you're going to get an app, a software, symptom checker or chatbot. Fine. But if you really need a person, it should sense that and get you to a human being. and then again, escalate it up all the way to, God forbid, you need to go to the ER, you need to go in right away. So
funny that
I think that's the journey we'll be on. Yeah.
Because actually, not too long ago, I had a very, very minor health condition, and I did not pick up my phone to look for a provider, but I picked up my phone first thing to get some answers, right? From Dr. Google.
Google, yeah.
What Dr. Google thought. But GoodRx,
everyone does.
Brilliant marketing, right? So it was a piece of content to answer the questions that I had, but the content led to an ad that said, hey, if you've got this issue, you can get your prescription today without leaving your house. And I was like, that sounds like a plan. And so I ended up doing, and I don't know if you would even call it a telehealth visit because I never got on camera. It was literally the chatbot. I answered some questions. Yeah, answered some questions. And then I did a text with a physician or nurse practitioner, and they just made sure, just verified and confirmed a couple of things. So within about 25 minutes, I picked up my phone to Google a question, but I'd already had my doctor's visit and my prescription that I could have either had delivered at my house or picked up. And I just chose to pick it up. It's a
wonderful story. Yeah. A great story. And I know GoodRx, they're I'm on their medical advisory board. I know them quite well.
Yeah.
But I think the other thing that's important about your story to just sort of emphasize is that what we at the ATA we call that asynchronous telehealth, where you're filling out forms or what have you, and you're getting responses. And I don't know what percentage of it is. I should, but I don't. There's some percentage of healthcare that is really, as you described, quite algorithmic in nature. I need X. Maybe it's a urinary tract infection or birth control, or there's a variety of services that are just, patients come to me all the time. I just need my meds refilled, doctor, and I feel like a fool, right? But so for that slice of healthcare, filling out a form, interacting a lot, and as you say, everyone's happy, and then they'll deliver it by drone, right? So
I was like, this is the best doctor's visit I've ever had.
Right. Yeah. But now to contrast that, if you were worried about something really, really serious and it was complicated and you would feel you wouldn't want to interact with a bot.
Completely. 100%.
So that's why I say we need to thread that needle in a way that makes you feel cared for. The experience you had, you felt cared for because, again, you knew what you needed pretty much. You got it. It was straightforward. But again, if it was ambiguous and you were worried about, God forbid, your life or your health, you want a person.
Completely.
So
100%. Yeah. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So you mentioned categories, and I kind of wanted to get your perspective on that because there are so many different segments or categories within, healthcare innovation. So which one of those are maybe further along than maybe some others? Telehealth, I think, definitely is one of them.
Yeah, we'll put that one aside because that's again almost like beating a dead horse.
Yep.
Well, I it's funny because I spent almost 30 years predicting things that took longer than I predicted. So there's a point in you're I would just say, throw a little kudos your way. You're an expert at disruptive innovation, so you probably have a better sense of when some of these things are going to get the top of the Gartner hype cycle or whatever analogy you want.
Yep.
But I think home testing is really ready for its coming out party. So that's one that so it's like simmering water. It's about to boil.
Yeah.
And I just hear about it all the time, all over the place. And again, COVID helped a lot because everyone wants home testing for COVID, but that's just one use case.
Right.
I think by contrast, I think the home devices one is harder. When I was a kid growing up in the early 60s, if we got sick, my mom would pull out the mercury thermometer, right? And just always take your temperature.
Yep.
And I mentioned that story because we need to make like the TytoCare device, the mercury thermometer. Everyone has one. It's in and I don't know how we do that, right? Does your health plan finance them? Do you just have to go out and cough up the cash yourself? I'm sure we bought our own mercury thermometer and we never thought twice about it. But somehow consumers aren't ready to invest in those kinds of home devices yet. So that home device thing is getting tremendous power, but it's still sort of stuck in limbo. Those are two examples of one that's a little more farther along than another, I think.
So let's talk about AI. What are the risks and rewards of AI? What should we be mindful of and what should we be really excited about?
Well, first thing to say is it's not magic. It is the idea that you have large data sets, very large data sets, and these days everyone has a lot of data about everything, right? So that's just
too much data.
Maybe, I mean, there's a lot. So then the second is you apply computer to it, and the computer will pull out trends. And that's phase two. And so there are these algorithms. Yes, there's algorithm innovation, but a lot of them are just off the shelf, right? You pull them off of a place called GitHub and put them on a database and see what happens. And we find out that it's the same way that 10 or 15 years ago it was novel that Amazon could predict what books you'd want, or Netflix could predict what movies you'd want, right? So that's at its core, that's what AI does. So apply that to healthcare, and there are many different applications. But if I, as a doctor, had, someone come in to me, I'm a dermatologist with a really puzzling rash, and it would be great to have the computer say, okay, of 10,000 people around the world, just like this is what happened. And AI could do that for me. The downsides, there's a couple of downsides, well, probably many, but a couple I'll highlight. One is the computer's only as good as the data feed into it. There's a wonderful, amusing blog called AI Weirdness. And the woman who's written it, her name is Janelle Shane. She's also written a book. And she does things like train algorithms. Like she trained an algorithm to use pickup lines in a bar. And the stuff that comes out is it's just crazy and it's silly. And the computer doesn't have any of that knowledge, right? It's only as good as what you feed it. Yeah. And she has wonderful, like she trained an algorithm. She had people trying to train the algorithm to recognize dogs versus cats. And it turns out that most people hold their cats. So the algorithm thought arms were cats. You have to understand that about computers. They are not smart at all. And so that means that this idea of bias creeps in, right? You take a database that's all about white people. I mean, there's a famous woman, I think she's faculty at MIT now, but she did this TED Talk when she was a grad student, how she wanted to study facial recognition, and the software would not recognize her face because she was a woman.
Wow.
So that's the problem with AI is we really don't. And so the latest sort of phrase is called explainability. You hear about that a lot. It's like people now, they don't just publish their outcomes of how predictive the algorithm is, but they have to do something to explain a little bit about how and why it works.
One of the
So
things
it's a
that's
journey.
fascinating is this isn't really a healthcare situation, but it just really was kind of like a light bulb going off for me. Um, I love TikTok. Like honestly, it's
Do
like
you?
my
Oh, good.
favorite program. And I just came across this video the other day, and it's probably a 3 or 4 year old little kid. You can't even see the kid. It's under the blankets with, of course, with its device. And
Yeah.
it is having a full on conversation with Siri as if
Yeah.
Siri is their friend or a person.
Yeah.
And so it's like, come on, Siri, put my game or my show back on. And the kid gets frustrated. And so kind of has an attitude with Siri. Siri says something back, and then the kid's apologizing to Siri. I mean, it's just, and I just thought, wow, how remarkable that generation is growing up having conversations with computers as
Yeah.
if they are a human being.
Right. Yeah. I mean, I think you're, that the nice thing about that story, or more than just amusing, I guess, is that it's 30 years out, we will be doing that.
Yeah.
When they're young adults, they will be doing exactly that.
Yeah, definitely. So I just want to talk about another trend, is just an aging trend with the population. So we've been talking for a long time now about, the growing boomer population. And there's a couple of different things that are happening with, the 60 plus, the gray market, right? Getting bigger and bigger and bigger. And, the trends of millennials, not having as many babies. So there's a lot of conversation of who's taking care of those folks.
Yep.
And so how, from your perspective, for all of the innovators that are listening and watching the show, what are just some of the things that come to mind with this aging trend, and kind of marrying that trend with like some of the trends in healthcare?
Yeah. So it's fun to talk about. This was the subject matter of this book that I wrote 5 years ago now, right? The New Mobile Age. I think you were helping me promote it at one point.
Yep.
So a couple things. One is that you I'll just underscore, because you really hit the nail on the head. We are literally running out of young people to take care of old people. Mm-hmm. It's a fact. And it's not news. That's been happening since about 2010.
Yeah.
The demand as we get older, we all need more healthcare services. It's just a fact. Even very healthy, fit, you just have more touches to the system. You just do. And so the demand for healthcare services continues to skyrocket relative to the supply of people who can provide those services. And the only way out, this is how it ties back to what we were just talking about. The only way out is to automate some of it. Mm-hmm. And so the reason that we not the reason, but one of the things that could be very exciting about this vision of talking to Siri or having a bot be your first interaction is or even probably more or less what you did with your story about getting something done in 25 minutes. Mm-hmm. Most of that was not, it was efficient for the provider, right? They had very little to do. They could spread themselves across many more people with your need than they could if they saw you in the office. Mm-hmm. So everyone wins out. So the more we automate, the more we use what I call one-to-many care models. Yeah. The more we enable, employ software, symptom checkers, bots, et cetera, and things like remote monitoring or home-based services. That's where we need to head for that. And then the other half of it, it's not the other half. There's many, many nuances to this interesting topic you brought up. But another thing that I always like to point out is, I just actually the other day turned 65. So now this is me, which is
part of the club.
Yeah, exactly. Like I'm waiting for all those old timer discounts to roll in. So far, not much has happened, but anyway, the notion that I'm in nowhere near retirement mentally. So that's just interesting, but we don't really know what to do with people when they get older. As a society, we kind of don't know it. So that comes as, again, people like me. So far, I'm not like breaking China and ruining things, but at some point, maybe my brain will be far ahead of my abilities, and someone will have to come to me and say, yeah, maybe not. There's that. There's the whole death and dying part of it. That's enormously challenging. How we handle those last few days of life, and so those are, I think, really important challenges. And again, for your audience, anything I just mentioned in the last few minutes is ripe for any kind of entrepreneurship and innovation, because they're all broken, frankly.
Yeah. It's funny. I just read recently that the fastest growing segment for entrepreneurship is like the 50, 60 and up.
Yes. Yeah. Isn't that exciting?
Is that?
Yeah. Well, because people have a little bit more wisdom, I guess, after having made all their mistakes. I don't know, but.
Well, they're just, what I was reading was that, the quality of life for that age group today and tomorrow is just very different than, years past. So we're maybe expecting more. That population is having more to give, and we're open to receiving that from that.
Thank God. Yeah.
Segment. Yeah, exactly. We're not just.
I say it because. Yeah, I mean, there's still a lot of ageism for sure, but it's getting better. I like to remind people that when Social Security was created and they decided that 65 was the age that you could get Social Security payments, the average life expectancy was 62. So.
Wow, I don't think I knew that.
Right. So think about it. So the government people weren't as maybe stupid. They brought this thing together. Sounds great. If you live that long, we'll give you a few bucks. And of course,
a real small group.
Right? But now with life expectancy, we just took a dip because of other things. But it's in the late 70s, et cetera.
Yeah.
I met with a friend the other day who's my age, and he said, well, I'm making my 20-year plan because there's longevity in my family, and I figure I got another 20 years at least. And if I think back to what I was doing when I was 45 and what's happened to me, and it's pretty exciting to think what might happen in the next 20 years. So you have to have that kind of viewpoint, I think, to tackle this thing, as opposed to having someone pat me on the head and say, go play pickleball.
Right, exactly. I mean, I think that applies to so many different people, but when, what I know about you is like, you're the guy that's standing on the beach watching the waves, and now you finally just seen the big kahuna come out, right? You want to ride this big kahuna wave as long as you can.
Yes, you're absolutely right. Yeah. Our time has come. Yeah. So, as we kind of just start to wrap up here, I'd love to end on, you're involved in so many different companies. Maybe this is an opportunity to give a shout out to some of those that you're a part of, or maybe just some that you've observed and admired. But I'd love to just kind of hear from your perspective a few of those either leaders or companies that are really just doing some incredible things and having some real impact to communities and to the ecosystem of healthcare. Well, thank you for that. And I would say a couple things. One is I tend to, because people ask me what I care about or what's, and I think in categories. So really the companies that I'm involved with are in a way strategic for me because I need to learn more about, or I think something is going to be big. Mm-hmm. So I am involved with a dermatology computer vision company called Piction Health, using artificial intelligence to help primary care doctors to make better triage decisions for dermatology. That's one fun one. And these are all early stage.
Yeah.
With one exception, which I'll mention. Another category that I really like is AI-driven behavior change in health. So two companies that I'm working with. One is called Sweetch, SWEETCH. It's an Israeli company. And they have what's called a time adaptive intervention strategy for chronic illness management that takes all these data streams in about you and then creates a motivational environment to help move you to a healthier state.
Ooh.
Likewise, another one that's earlier stage, just forming, just getting funded, called Juli, Juli, based out of Switzerland. Similar concept, more applied to mental health and a couple of other things. So that category interests me a lot. I'm always up for new devices. I'm advising another Israeli firm that's doing wrist-worn blood pressure check. If we could ever get blood pressure to be easier than pumping something up, and that would be a big breakthrough. So I'm helping them where I can.
Yeah.
And then I'm on the board. The one that I'm working with that has some level of scale is called Mobile Help, and they have two main product lines. One is personal emergency response units, so people can easily call an ambulance if they feel sick. And their other subsidiaries, their remote monitoring subsidiary called ClearArch Health, where I'm involved as well, and that's more of a remote patient monitoring play. And they're big enough. They're private equity owned. They're big enough that they have some pretty significant scale. If anyone out there is being advised by me and I didn't mention you, I apologize, but I'm just hitting the highlights. So
he loves you. I promise he does. Oh, I also know that you are the president of the ATA and want to give you an opportunity to promote the upcoming events.
Thank you, Roxy. So we changed that role to chairman of the board, and that the reason is when I originally went. So this is my second time in the role for whatever insanity that presents. But first time around 2005-ish, it was common for associations to have a president elected for a year or two and an executive director. And of course, nowadays you would appreciate this. There's no more executive directors, or they're rare. It's more CEOs. So with ATA, having a president and a CEO just confused people. So we changed that title to chairman of the board. But our upcoming annual meeting is in Boston this year. It's May 1 through 3. It's really going to be, it's because we're just starting, as you know, to do in person again. So by that time, I'm sure the virus load will be way down. It'll be fun. I hope you can come.
Yeah, with
so that's May 1 through 3. The content, I'm helping with the content for that. It's going to be a fabulous program, great networking, great opportunity for people to see what's in the vendor space and et cetera. So I highly recommend that show. We do a policy conference in the fall. We just did early December last year, so that one will come up sometime in the fall. But the ATA is special interest groups. There's all kinds of ways we engage with people outside of those meetings. So if you're involved in and I really mean this, if you're involved in telehealth or telemedicine, you must be part of it. We're advocating to move the industry forward. We have a huge policy emphasis. We just created a 501c6 to do advocacy. So the organization is very much on the move and on the growth phase, and it's exciting to be part of it.
That's great. Well, it's always a pleasure to have you here with me. I always say we're going to do it more often, and we just get so busy. So thank you for carving out some time for us today.
Thank you for having me, and I look forward to promoting this and getting the word out as you air it.
Awesome. Thank you so much. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.